So in this video, we are going to be talking about proton pump inhibitors, PPIs. So let's imagine we have a 45-year-old man. He comes to visit his doctor, his family medicine practitioner, his GP, and he has a 3-month history of on and off nausea and that heartburn kind of sensation. So that pain in the center of the chest shooting up, that sensation, and it gets worse after he eats fatty meals and sweet meals. He's generally fitting well. He doesn't have any other medical history. He's got no red flags that make you think, oh gosh, we're really worried. His BMI is 32. So what are we thinking? What's the doctor thinking? Well, it's reflux, and let's think about giving him a PPI, a proton pump inhibitor. So in this video, we're going to be talking about how often this medication is prescribed. We're going to cover how a PPI works, the important side effects of it, adverse effects, what to discuss before starting it, how long to take it, and when and how to stop. So stick around to the end of the video to see how we're going to taper off a PPI and not be on it forever and ever and ever. This is such a common presentation, such a common thing, and let's get into the video. So how often are PPIs prescribed? So in the UK and probably worldwide, prevalence of proton pump inhibitors is about 15% of the UK population. So that's wild. In 2022-2023, there were 73 million prescriptions of PPIs. The cost was about £190 million, which is a lot. It was 1.8 of the total primary care prescriptions and 6% of all prescriptions dispensed. The most common ones are omeprazole and lansoprazole. There are other ones that you may have heard of, but these are the most common ones. To reflect that onto the USA, for example, you have prescriptions that are costing up to $10 billion in annual direct healthcare costs. Hospitalization for GERD has flown up, and we can certainly have a conversation as to why that has happened. But nonetheless, there is strong evidence to support that PPIs are used across a range of indications, and they are quite useful. So let's talk about that quickly. So it's used in the treatment of upper GI disorders characterized by excessive acid production, which can then damage the upper GI tissue. So reflux is the main thing. GERD, gastroesophageal reflux disease. You use them when you give certain medications that can erode the stomach lining, so such as NSAIDs and steroids, so gastroprotection from ulceration. That's another reason why it's used. And for H. pylori eradication. So those are the main reasons generally why we're using PPIs. So is that enough to warrant all those statistics that we just mentioned a second ago? Is it enough? Well, it's certainly an interesting question. So now let's move on to how PPIs actually work. So generally, PPIs, they decrease the stomach acid secretion into the stomach by irreversibly blocking that little ATPase in the drawing there in the cells of the stomach. So PPI comes along and it shuts down and irreversibly blocks that ATPase, and therefore you don't have any more stomach acid, or you have a reduction of it or a decrease of it. That's how PPIs work. So it comes in and it shuts off that ATPase, and there's less acid produced, and hopefully that then alleviates your symptoms. So that's very easily put. That's how PPI works. So what do we need to discuss before us starting a PPI? So what are the things we need to consider? So going back to our 45-year-old gentleman from the start of the video. So he's talking to his family medicine doctor, and they decide that we should start a PPI. Well, what are the things we need to talk about beforehand? So have we ever taken it before, and has it helped? We need to consider the fact that it may take up to 4 weeks to notice any effects, so we need to be realistic about taking the medication. We need to understand that if it's not working, we need to review it. There's no point taking something that's not helping, is there? And the most important bit probably is to discuss lifestyle. So what are the modifiable factors and the non-modifiable factors of treating excess acid and getting on top of GERD? So the big ones there, modifiable factors, there's a lot more of them compared to the non-modifiable factors. And we should definitely be doing everything we can to tip the scale in the other direction. So some things we can't control, such as our age, gender, whether we're pregnant, well, we can, but you know what I mean. And the things we can control, we should really zero in on and tackle, as you can see there. So smoking, weight, lifestyle in general, diet. What are the important side effects to discuss when we're talking about PPIs? Because it's a medication we're going to be taking at the end of the day, and these things have their pros and cons. So common side effects of PPIs can include constipation, which is hopefully transient. We can get another lower GI symptom, which is diarrhea. We can get generalized abdominal pain, which is something to keep track of. Nausea and vomiting can occur. So these are generally the common side effects that we need to just keep an eye out for. If they're happening and they're making us feel too unwell, then it's time to discuss it with our doctor, because there's no point taking something that's making us feel worse. And then we have less common side effects. So these are things we really need to keep an eye out for, and gladfully they're less common. So dry mouth, headache, insomnia, skin reactions, so various rashes can occur, and also interstitial nephritis. That's an interesting one. So that's a kidney problem, and PPIs are now one of the most common causes of interstitial nephritis. The other thing is calcium. So we need to assess dietary intake of calcium and vitamin D. So people taking PPIs have a higher rate of fracture compared to non-users. So this is something we need to keep an eye out for. PPIs increase the susceptibility to Clostridium difficile, which is a gut infection and quite problematic. An increasingly recognized complication of PPI use is hypomagnesemia, so low magnesium, which can lead to other issues with your hypoparathyroidism and your calcium levels. It has also been linked to an increased risk of pneumonia, dementia, vitamin B12 deficiency, and chronic kidney disease. So the pneumonia side of things is due to the changes in the pH of the acid in your stomach. So there's a lot of things to consider when we're actually thinking about trying out a PPI. And then on top of that, you have drug interactions. So some of the less common known ones are there, and some of the more common ones are listed there as well. Then there's the pregnancy side of things. So it's not known to be harmful. However, it's potentially linked to higher rates of asthma. So these are all the things we need to consider when we are talking about taking a PPI. When we take PPIs, how do we monitor this? So up to half of people given PPIs have had them reviewed, and half have not. So you have potentially a bunch of people on a PPI that have never had it reviewed. And then you have between 30 and 70% of people that have a PPI prescribed and it's not even indicated. So they're taking a PPI for not even the right reasons, which is very crazy because of what we just mentioned earlier on. So prescriptions should be reviewed regularly, which they are not a lot of the times. Who, when, and how to review side effects is absent from international guidelines, which is very interesting to point out. According to some authorities in the UK, for example, they suggest checking magnesium levels before starting a PPI, check magnesium levels intermittently during long courses of PPIs, recommend to check magnesium every 3 months in high-risk groups. I guarantee you that a lot of this doesn't happen. And then on top of that, despite us just starting a PPI, we still need to recognize that if certain red flags start to pop up, mainly related to cancer, then we need to be vigilant and recognize that and not just blame things like reflux. So these are the things to consider and even monitor when we do start a PPI. Then the next question is, when do we stop it? How do we stop it? What's the plan forward with that? So the first review, when you start a PPI, it should be at 4 to 8 weeks. So we should reassess the situation. You have to stop it if it's ineffective, because if it's useless for you, why are you taking it? If it's effective, then you should consider reducing the dose or using it as required. But the longer you're on it, the more of a chance you'll get something called rebound hypersecretion of acid. So we need to understand that there might be a reason not to stop it at all, right? So we alluded to some of that earlier on, and here are some reasons not to stop it as well. And what can then affect our delay or our tapering of the medication or reduction of the medication? So the duration of the PPI and its use, we mentioned that. Whether there are other compounding factors, so whether there's uncontrolled stress, if we stop the PPI, are things still going to be out of control? And whether there's gastroparesis, so delayed stomach emptying, for example, as well. So that requires a different approach entirely. So how do we taper a PPI finally? So this is a big question, and hopefully we can provide a little bit of guidance here in this video. So there are 4 ways to taper a PPI, and they're quite individual, quite different, and quite easy, I would say, but not a lot of doctors, not a lot of people know about it in general. So we can taper the PPI, we can do an on-demand approach, we can step down, and then we can taper plus step down. So those are the 4 options. So tapering it means that we decrease the dose by 50% every 2 weeks, for 2 weeks. Then we stay at the lowest dose for 2 weeks, and then we stop the PPI. On demand, as you can see there, step down requires a different medication entirely, an H2 blocker, H2 antagonist, which effectively swaps over for the PPI, and then you use that until the symptoms subside. And then you have the tapering plus the step down. So feel free to pause the video and have a read of that. All of these things of tapering, though, they must come on the background of lifestyle changes. Otherwise, the effects are going to be limited and the tapering will be more difficult. So ideally, you should be on it for a few months, implement the lifestyle changes, and then slowly taper off it, and off we go because we have a healthier lifestyle. So this was a quick rundown in this video. There's a lot more to talk about. There's lots of videos we can make on this, but feel free to leave your comments in the section below. Like and subscribe for more. I'll put a few interesting links in the description below, and we will see you in the next video.